Angioedema. Most common cause of acquired angioedema is ACE inhibitor, that is kinase. What is the mechanism? Usually the bradykinin and substance P are broken down by ACE inhibitors into its metabolite. But if ACE inhibitor is given from outside, it leads to direct action plus prostaglandin production, which leads to edema, inflammation and pain. And it can ultimately lead to angioedema. A characteristic that sometimes the patient tells you that he has some tickling or scratching sensation in the throat days to weeks after having ACE inhibitors. And the management consists of, for management, the first thing we have to see is whether airway compromise and vasomotor instability is there or not. If it is present, the person requires subcutaneous epinephrine immediately. If even after epinephrine there is airway obstruction like muffled voice, inability to swallow, and the patient is in tripod position, that is sitting up, extending her neck despite normal oxygen saturation, the person requires immediate airway protection. We give that patient awake fiber optic nasotracheal intubation. Why do we give this? Why not oral? Because in oral we have to make the patient sedate. But nasotracheal can be done awake, allowing continued airway protection, or sitting up, keeping the tongue forward and airway more open. Also, the procedure is more appropriate in angioedema as it avoids placing a laryngoscope through the narrow swollen oral cavity, which would be especially difficult in patients with angioedema because it avoids placing a laryngoscope through the narrow swollen oral cavity, especially difficult in patients whose soft palate or uvula can't be visualized. Ideally performed in OT with the team prepared to perform a surgical airway procedure like tracheostomy or cricothyrotomy if needed. After airway is maintained, nasogastric tube can be placed in patients unable to swallow anything. So if the nasotracheal tube fails, we have to do cricothyrotomy or tracheostomy, and obviously we have to stop the ACE inhibitors. Other adverse effects of ACE inhibitors are coughing due to angioedema, also hyperkalemia, potassium is high, and precipitation of acute renal failure in patients with bilateral renal artery stenosis.